Welcome back into Daybreak. We've all heard of arthritis, but did you know there are more than 100 types of arthritis? What are the symptoms, and more importantly, what can be done to help? Joining us this morning in the studio is Dr. Fred Nagel with the Baptist Health Family Clinic in Maumelle with some answers for us. So, Dr. Nagel, thank you for joining us, and more importantly, Happy New Year.
Well, Happy New Year to you, Chris.
All right, let's talk about what exactly is arthritis?
Well, arthritis, by definition, is inflammation in a joint. And this occurs when you lose cartilage that gradually is destroyed on the surface of the joint. And that forms a padding or shock absorber on the joint. So when you lose that, that's when you develop that painful arthritic joint.
What causes it exactly? You can see some pictures here of the erosion they're saying.
That's the cartilage that you're losing in the joint, and this demonstrates that happening in the hip. And you can see how that bone is on bone and is going to be painful. But the causes of arthritis vary depending on the type of arthritis. As you mentioned, there's a lot of them, a lot of different ones. The cause of the arthritis is going to be that underlying inflammation. For instance, in osteoarthritis, it's going to be wear and tear, which is going to be through aging, usually the weight-bearing joints, the knees and hips, but it may be also some joint used repetitively, like your hands and shoulders. Contrasting that would be rheumatoid arthritis, which is an autoimmune disease where you actually produce an abnormal antibody that attacks the joints, and that could cause rapid destruction and deformity, and can be quite painful and debilitating. Yes. And then there's also gouty arthritis, which forms uric acid crystals in the joint, setting up an inflammatory response. So you can see there's lots of different mechanisms and causes for arthritis. But popping your knuckles does not cause arthritis.
That is great to know, because I do that almost every morning. Let's talk a little about what are some of the symptoms. How does someone know whether or not they have arthritis, or is it just maybe a pain or a sore in their joints?
Well, the classic symptoms are going to be that joint pain, stiffness. Sometimes you will have swelling and even warmth. And the people that are going to be most affected are going to be the older people, usually 50 or 60 years of age, because of that wear and tear, since osteoarthritis is the most common. But there are some specific rarer forms of arthritis that can affect young people as well. Also, if you're overweight, that's a big risk factor for causing arthritis. If you've had previous trauma to a joint, that can cause arthritis. And then there's also genetics that play a role.
All right, let's talk about what are the treatments. That's something that I know a lot of people would like to know.
Again, the treatments are going to vary with the type of arthritis and the severity. Usually you'll start with something simple like Tylenol, aspirin, an anti-inflammatory, and then your doctor may prescribe something more potent if that's indicated. Joint injections can also be helpful. Also exercise to improve the strengthening of the muscles around the joint and improve flexibility. Physical therapy can help with that. And then with treatment, you can also, with an evaluation, you can also get x-rays, and we have one of those here that shows a knee joint that is normal on the, on the left and arthritic on the right, and you don't have to be a radiologist to see the difference in that painful joint on the right.
Ouch. Okay, well, we certainly want to thank you for coming in today. We have your information right here on the screen. You can call the Baptist Health Line at 1-888-BAPTIST. That's 227-8478. Dr. Nagel, thank you so much for coming in. Happy New Year to you, and we hope that helped anyone out. This will be posted online if you'd like to go back and rewatch it. Just ahead.